Hello.
Hi, everybody. How are you?
Welcome back. It's your co-host,
Tricina Greer.
Amina Hines, representing Mental Health for All. And today we're going to continue our segment on suicide.
Last week, we talked about suicide and some of the causes of suicide. As you know, there is no single cause of suicides. There are many risk factors and warning signs when it comes to suicide attempt. What leads to suicide? There is no single cause, like I said. Suicide usually happens when someone is feeling hopelessness, that they don't see no way out. It's like they just don't have no dreams. All their dreams have been diminished, or they have some kind of physical aspect wrong with them, or it could maybe be depression. So those three are really the highest causes of suicide attempt. And when somebody try to commit suicide, it's not that they really want to die. They're really trying to reach out for help. They're crying out for help. Their pain gets so intense that they don't know what else to do. So they just want to relieve their pain at that moment. So that's when a lot of suicide attempts come into effect. It's to alleviate the pain. It's not that the person actually wants to die. They just want to relieve from all the different issues that they are going through in life. Some of the health factors are, like I say, depression, substance abuse, bipolar disorder, schizophrenia, personality trait of aggression, mood change, poor relationship, conduct disorder, anxiety disorder, serious physical health conditions, including pain, traumatic brain injury. So see, there's a lot of things that will make someone feel hopeless when it comes to dealing with all these issues. Come on now. You can't help but feel hopeless, So that's why a lot of people want to commit suicide, is because of some of these conditions above. So I'm going to leave it at that right now, and I'm going to pass it to Amina so she can finish.
Okay, so there's two important things that I want to cover today. First, even though there are a lot of risk factors involved in suicide, these risk factors can be reduced with timely intervention. So to prevent suicide, one of the first things you need to really do is to know what the risk factors are. We won't cover them today, but we mentioned them in the previous video. I will say that teens and elderly that have gotten divorced or lost a spouse are at the top of the list. So please see our last video for more details. The second thing you can do to prevent suicide is to know the signs of depression and mental disorders that Tricina just mentioned. If you can remember, she mentioned bipolar and traumatic brain injury. So when you know the signs of these illnesses, suicide is not far away in many cases. And the last thing are the warning signs of suicide. So we mentioned that previously, but I'm going to quickly go over that because I believe it's worth mentioning. But one of the top warning signs is when someone talks about death in an unusual amount. And they may say things like, maybe it would be better if I wasn't here, or the world would be better without me. So any comments like that is a warning sign. And just note again, this is worth mentioning again, that you must take every threat seriously. Do not assume that the person is just trying to get attention or it'll pass. So now if you've seen the person meets the criteria as having the risk factors, they exhibit signs of depression or any mental disorder that we mentioned before, or they're giving warning signs of suicide. Mainly they're saying that they would rather not be here, or they're finishing business, preparing a will. And remember, these things are not necessarily in isolation, but they work together. So if you do think that someone is suicidal, you can reduce the likelihood for them to act on these suicidal impulses. One, by giving support from a caring friend or family member. A big way to reduce suicide is having access to mental health services, because like we mentioned, depression and mental disorders, these are sometimes chemical imbalances. So they're not just thinking these things. It's not all in their heads. The third thing is to help them avoid social isolation. And 3 quick things. Don't be afraid to ask someone if they're considering it. Because even though people talking about death and saying they want to kill themselves is a big sign, 50% of people they never say it. So if you're seeing these signs, ask. Don't be afraid. Also ask if the person is seeing a therapist or taking meds. And finally, let them know that depression is treatable and it is temporary. Most people do recover with proper treatment and care. And do this rather than trying to talk them out of committing suicide, because that doesn't really help. So yeah, just say that there are solutions, there's help out there. And we always like to leave you with the National Suicide Hotline number, which is 988, or if you prefer text, 741-741. So please come back again next week and we will talk more about environmental factors of suicide and ways you can actually treat people that have suicidal ideations or thoughts. Thanks again.
Thank you.
Bye-bye.
Bye-bye.